Welcome to Future Talk. This is the program that examines the global impact of technology, both for good and for bad, and tries to see just where the new technology is leading us. On today's program, we're going to talk about a new approach to healthcare, sometimes called Health 2.0. It's about using internet technology and social networking websites to enable people to be better informed about their own health conditions and more active participants in their own health treatment. I have two guests. Thomas Getz is executive editor of Wired magazine and author of the new book, The Decision Tree, Taking Control of Your Health in the New Era of Personalized Medicine. Jennifer McCabe is co-founder and CEO of Contagion Health, which is a software company that creates social networking tools to help people with similar health goals share their experiences and ideas. Jennifer, what exactly does your company, Contagion Health, actually do?
So Contagion Health builds social applications that allow people to share healthier behaviors online. So we use Twitter and Facebook and your existing relationships to motivate you. We have a challenge application called Get Up and Move, which is at http://getupandmove.me, that lets you challenge friends and family to small acts of fun fitness activities, like I will do 50 bed jumps if Thomas will make a snow angel, or I will dance to 2 songs if you will run for 5 minutes.
Now, I understand that we have a video that shows some of the motivation that you had for getting into this work. It's an excerpt from a speech you gave in Boulder, Colorado a couple of years ago. We're going to show that video and then come back and discuss more of your work. So let's go ahead and roll that tape.
To improving healthcare. Addicted, absolutely, obsessively. And everything that I do is about connecting people who might actually be able to help me get that done. If you look like you do something useful, I want you to start fires with us. No, actually, this is what's happening to healthcare in the US right now. Okay, so it's a series of escalating events leading to combustion and epic fallout, right? That's pretty scary. But I'm one of those people who believes that we haven't reached mutually assured destruction yet, but we will. So why should you care? Most of you probably don't need health care. We need you more than you need us. But the good news and the bad news is that at some point you will be a patient. You will need health care. And at that point, it doesn't really matter what you do. It doesn't matter how many followers you have on Twitter, how many businesses you've successfully exited from, right? You need an anchor. You need something that's going to help you weigh in the system. So this is my story. I'm here from the patient perspective. I'm not a doctor. I'm not a nurse. I'm a crazy healthcare person. 8 years ago, I fell asleep at the wheel and hit one of those anchors dead on, crushed my right knee and ankle. Doing great. But I realized that I know more about my body and what works for me and what doesn't than my doctors do. I am now a hyper specialist in my condition. Well, good, maybe. I know I can do some crazy things. Bad because there's no way to communicate with my provider, with my doctor, the hard freaking won, subjective personal knowledge about my health care that I need to have a two-way conversation with them about where I'm going next.
So you got into this work largely because of your own health experience. You smashed up your leg in an auto accident.
Yeah.
Now, if the social networking tools you're working on now had been available then, how would they have helped you?
That's a great question. When I first got hurt and had my initial surgeries in Maryland, the only thing that was available for patients on the web, this was 2000, were listservs and resources for doctors and medical students. And this was in very complicated professional language. So even as a relatively educated person, it was difficult for me to find information that was valuable. But there was a site called mybrokenleg.com, which is still available, that patients that had really grisly kind of leg injuries were sharing what worked for them in physical therapy, what kind of clothes they could wear, how they recovered after surgery when they had bowel issues or these other really embarrassing things that your doctors don't talk to you about. And that was just a kind of information list that was static, where you put something up and someone had to find it using a search engine. Now the social networking tools are absolutely amazing. In real time, I can find people that have the same condition that are sharing all of this important knowledge about what works for them and what doesn't. It would have changed my mood and perspective. It would have changed what I thought was possible for someone with my condition.
Mm-hmm. So now, in your company, do you create your own platforms for social networking, or do you basically build on platforms that are already there?
It's a great question. So at Contagion Health, we believe that even though illness is viral, healthy behaviors and healthy information can be contagious too. one of the differences between the way that we work and the way that other companies and organizations work is that we believe your existing relationships are the most important thing to learn from. So we tap into existing social networks that you already use, Twitter and Facebook. Rather than creating another isolated community of people who are ill, we let you connect with people who are healthy as well to provide the motivation and support you need.
Now your Get Up and Move program, that's on Twitter. We actually have some slides to illustrate that.
Oh,
maybe we could show those slides. We have a series of slides that show some of the Twitter pages, which should be coming up momentarily. So now how does this work? Someone sends a tweet that says, if you do 10 push-ups, I'll run around the block.
Yeah, so you can see some here now. One of the things that we do is we've found that we have people all over the world using Get Up and Move. And the way that people talk about using Get Up and Move on Twitter is to use that thing that looks like a number sign. And you see, yeah, you see Get Up and Move all together. That's called a hashtag. And on Twitter, it's like a code word. It lets people opt into a system and let them know that other people are doing the same thing or they're at the same event.
So with the hashtag, by putting that hashtag in your tweet, then anyone can search on that hashtag and find all the tweets that contain that hashtag.
That's exactly right, Marty. So you not only can work with people that you already know, but you can find new people to work out with using the Get Up and Move hashtag.
Now we also have platforms like Facebook, and anybody could start a group on Facebook and say, this Facebook page is dedicated to a certain disease. Is that adequate in itself, or do you propose to add new features and build upon that to make it more useful?
I'm biased, but I don't think that that's adequate in and of itself. When we start talking to people who have serious conditions, you find that even among those people, illness is not the sum and total of their identity. So a condition or disease-specific network that just focuses on the part of you that's ill, I don't think helps you determine what you do when you're not in the hospital. It doesn't help you live in a healthier way with the daily decisions that you make. And that's what we want to do. So that's what we enable. We make sure that if you're going to challenge someone using a Contagion Health application like Get Up and Move, someone else has to complete that challenge too. You have to motivate not only yourself, but someone else to a healthier behavior.
Let's take a specific example. Let's say that someone has some kind of lump that might be cancerous, and they'd say, I'd really like to connect with other people who are having a similar condition so I can learn about their experiences, learn what they did. Is there any site they can go to now that will provide that for them?
Interesting. So there are lots of sites that you can search for the things that are of concern to you. Google, other search engines will let you say things like, I have a lump in my neck, and try to find those resources. But we find that those resources are generally provided by doctors and hospitals. And if you want the specific shared experience of someone who is going through the same thing, you want to go to where they're already talking about that condition, and that tends to be an existing social network, like Twitter or Facebook. In particular, we find that people, when they're pre-diagnosis or first diagnosed, that they continue to use those whole social networks rather than ones that are condition-specific.